Greetings from Waikiki Beach in Honolulu, Hawaii. Today I'm going to talk about what families really want. I'm now actually going to move inside where it's quieter since I'm right above the street level here. What families really want? This is a question that you would think we attend to quite clearly in early intervention, and yet I wonder if our methods of finding out what families want are adequate. So everybody knows that in our model we use the routines-based interview, and the routines-based interview clearly addresses the immediate and functional needs of children and families. But I've been thinking recently about the broader question about what families want for their children and for themselves. I've been inspired in part by a talk I heard yesterday from a self-advocate with autism spectrum disorder who made it very clear that it was important for consumers or people with autism or intellectual disabilities or developmental disabilities to really figure out what it is that they want from their lives. Also, of course, the work of Marsha Forrest and other people who have done maps and circles of friends and so on have always looked towards the bigger, further picture for what people with disabilities want for their lives. But let's apply this a little bit to families in early intervention and early childhood special education. When we think about the direct daily functional needs that they have, it's often about children being able to do things at different times of the day, with the bigger picture being that the children will therefore be more competent in school, in home, in society, and so on. Families also sometimes want some things for themselves so that they can be more fulfilled in their lives, better parents, better people, etc. The same sorts of things that any of us might want. But when you look at the specific needs of parents of young children with disabilities, I'm wondering if it doesn't boil down to parents want their children to be able to function, to be able to do things through their day. That is, to be competent in their routines. Now, to those of you who know my work, you'll know that this is old hat. It's just basically regurgitating the same stuff I've been saying for years. But I think that my focus was often on putting out fires. It was often on helping families identify those little things that could be, that the child could do better, that the child will accomplish in 6 months, and so on. The things that the child perhaps isn't doing now, or it's just the next step in the child's development. So it hasn't been deficit-oriented necessarily, but it has been around the little skills that we have to work on as parents with our children. But then when I think about why we're doing this, why parents want their child to be able to sit up independently in the bathtub, to be able to hold a spoon and use it effectively at meal times, and to be able to draw somebody's attention to something they're looking at. Why do families want children to be able to do that? I do think it comes back to meaningful participation in the lives that children have in front of them. That is, when, regardless of whether a child is growing up in the streets of Cairo in Egypt, or in the fields in Malaysia, or in a village in Africa, in an urban environment in the United States, or a rural environment, or a middle-class neighborhood, regardless of the life that they have in front of them, families want their children to be able to do things, to be able to be participants in those, what I call routines. So our work over the last few decades hasn't been in vain. We, I think, have been aiming at that, even if we didn't see the bigger long-term picture. But this does come down to what should our outcomes be that we use to assess our success with families. Now, we know what the federal outcomes are, and I'm not going to spend time discussing those. They are what they are, but I do think we need some other outcomes. So I do think that for children, we need to have some index of the child's engagement, the child's independence, and the child's social relationships, as I've always been saying. But I also need to consider whether we should be asking families in either a measurable way or in a qualitative way, whether the extent to which they feel their children are improving in their meaningful participation in everyday life, and in addition to improving, whether they're satisfied with their child's current level of participation in everyday life. Participation, of course, is a big topic for the International Classification of Functioning, as it is generally in the disabilities field as really the new way of considering a person's functioning. If they function, they're participating. Participation doesn't always have to be social, by the way. So there is participation in solitary activities, there's participation in social activities. There are many kinds of participation. It all depends on the demands of the routine. So some routines require or elicit or draw forth, that's illicit, social types of participation, others more solitary types of participation. In addition to all of this, we have to take the child's style, what some people call personality or temperament, into consideration, so that we're not forcing children into a certain type of participation that doesn't suit them individually. And then there has to be some self-determination even from an early age. So striking the right balance between allowing a child to determine the extent to which he or she wants to participate, and yet pushing the child a little bit so that the child becomes aware of the possibilities if you participate more, and also so that if the child isn't participating because of a lack of skill or confidence, we need to try to help with that skill acquisition and that confidence. All of this is back to saying, I think that maybe we need to be paying a bit more attention to what families ultimately want for their children, and let's find out whether that desire on their part is about meaningful participation in everyday routines. Okay, best wishes from Waikiki. I'm going to be going back to cold Nashville soon. Bye-bye.